Good afternoon. So welcome back to Wednesday Reading Live. This is me Vandana PS joining you from 𝐻𝐂's Academy. Okay, so apart from the usual strategy, I'll start with part B, a detailed explanation about part B. Then I'll give you 2 minutes to do the question. Okay, so what about part B? Any idea regarding part B? So what do you know about part B? Okay, so part B actually, only after the completion of part A, they will provide you part B and C, right? Okay, so within 60 minutes, we have to complete 3 different parts, which is part A, part B and part C. Okay, so what is part B? So part B is all about a set of or a kind of different categories of questions will be there. I can say 3 categories of questions. So the first category, which is guidelines. Okay, in the second category, they will be dealing with manual or policy, and in the final category, it's all about email, memo, notices. Okay, so these are the 3 categories of questions that you guys will deal with in part B. Then what about the total number of questions? I can say total number of questions will be 6. Okay, 6 number of questions will be there. And what about the timing? Alright, so out of the 60 minutes, we will get 45 minutes. There is no separate time for doing part B and C. So together you will get 45 minutes for part B and C. And in this 45 minutes, we can take almost maximum, I would say, 12 minutes for the completion of part B. Okay, so within this 12 minutes, we should complete 6 questions. And what type of question? Any idea? What type of question? The type of question, it is multiple choice questions with 3 answer options. Okay, multiple choice questions with 3 answer options. Okay, then what strategy we are using here, or what method we are using in part B? The method is called elimination method. So after the question, I'll show you what is elimination method. Okay, and that's all about part B. So I'll show you the question here, and I'll give you 2 minutes for this question. So here comes the question. Okay, so welcome back. Okay, so Sobi, Kavita, yes, good afternoon everyone. So what about this question? Okay, so I'll read the question, then we will look into the answer, okay? So how much cardiotocograph training must be completed to complete the phone program? Okay, and the question seems to be a little bit difficult, I think, as well as the options and the paragraph too. Okay, so how about this question? Was it difficult, Sobi? Was it interesting? Okay, so yes, so what are the keywords from the question? Any idea? What are your keywords from the question? Because it only keywords will help you to find out the correct answer. Okay, so what about the keywords? Okay. Okay, Smita, yes, good afternoon, dear. Yes, so what about the question? Okay, so keywords, how much cardiotocograph training must be completed to complete the phone program? So my keywords from the question which are, how much? Okay, even though the question seems to be a little bit difficult, actually this is a very simple question, okay? I'll give you why. See, how much cardiotocograph, then completed. So these are my keywords from the question. Okay, so B, your keyword is cardiotocograph, right? It's not cardiograph, dear, it's cardiotocograph, okay? Yeah. Yes, so these are my keywords. How much cardiotocograph completed? So these are my keywords from the question. So that is the first step, read the question. So already read the question. Second step, underline the keywords from the question. So my keywords, how much cardiotocograph completed. Then the third step should be, read the options or you can read the paragraph. So today I'm going to read the paragraph first, then I'll move to the options, okay? So you guys can read the para. This is a memo. So memo to all staff, mandatory phone requirements bulletin. Okay, so which comes under which category? If it is a memo, that means it is from the third category, okay? So third category, which means either email, memo, notices. So this is a memo, okay? So that's from third category, memo. If it is a memo, then what are you reading for in that category? Any idea? What are you reading for in the third category? Okay, so in the third category, we are reading for the purpose. Okay, so what is the purpose of this particular memo? So purpose, which means the overall idea. Clear? Okay, so we are reading for the purpose. Okay, then I am reading the paragraph. So completion of all components of the phone program is mandatory for all NSW health maternity clinicians, including GPs as well as trainees, then registered midwives and midwifery students. Then this is to occur in 3 yearly cycles and will consist of, then here comes the point. So what is the first one? 16 hours to complete the online K2MS perinatal training programs once every 3 years, which includes fetal monitoring. So these are the two important case studies mentioned here. The first one is fetal monitoring training system, including 15 cardiotocograph or CTG training sessions. Then maternity crisis management training system, that is a second case study. And the second bullet point, 2.5 hours to complete 2 K2MS fetal monitoring training system. Then training simulator CTG case studies every year within the cycle where the entire fetal monitoring training system is not completed. Then, so what about the next point? 16 hours to complete both face-to-face education sessions. Then education sessions once every 3 years, then fetal welfare assessment as well as obstetric emergencies and neonatal resuscitation training or ONT. Then chief executives of local health districts are responsible for supporting then phone facilitators, maternity clinicians, monitoring phone completion compliance, okay? And that's all about the para. So what about the correct answer here? So without even reading the questions, you guys can identify the correct answer here, because question is directly asking you regarding how much cardiotocograph. So how much? So how much means etra. Okay, so what is how much? So what is the number mentioned here? How much cardiotocograph? So how much cardiotocograph? Okay, so B, C, but confused in 15 hours. Okay, 15 hours. Where they've mentioned about 15 hours, it's 16, right? Okay, Libby. Yes, Kavita and Sobi, purpose of the para. Very good. Okay, Sunita. Yes, Jalajam, good afternoon. Okay, dear, purpose. Okay, yes. Then coming back to this question, any idea what is the correct answer here? How much cardiotocograph training must be completed to complete the phone program? Whether it is option A, B or C. So option A is like 2 face-to-face training sessions. Okay, yeah, it's mentioned here. 2 face-to-face training sessions and 15 case studies every 3 years. Okay, and what about option B? 16 hours online training every 3 years and 2.5 hours annually. And what about option C? 2 case studies and 15 simulator cases every 3 years. Okay, so any idea how can we eliminate the options? Okay, so your answer is option C, right? Okay, so may I know how you eliminated A and B? And you're confused with option B, right? Because, yeah, this 16 hours, right? Okay. Yeah, again it is 16 hours, not 15. So any idea? What about others? What is your answer? Whether it is option A, B or C. Let me know in the comment box. What is your answer here? Whether it is option A, B or C. Okay, so I'll show you what is elimination method. I'm starting with option A. 2 face-to-face training sessions. So before that, please understand the question. Okay, so what is the question here? How much cardiotocograph? So how much cardiotocograph is mentioned? Okay, very clearly in this first point they've mentioned 15 cardiotocographs. See, the number is 15. So the question is how much? Answer is 15. Okay, and from the options, so simply you can eliminate option B because nothing mentioned about 15 cardiotocograph in option B. So it's not option B because contradictory or opposite option, no mentioning about 15. Okay, so maybe it is option A or option C. Okay, Kavita, B. Okay, once in every 3 years, option A. Okay, so B not mentioning 2 face-to-face. No dear, actually 2 face-to-face is mentioned. Okay, in option A, 2 face-to-face training sessions, it is mentioned here. See this particular point. I'll show you that point. Yeah, here 16 hours to complete both face-to-face education sessions once every 3 years. So which means face-to-face session is there. Okay, but why we are eliminating option A? It is already mentioned, 15 cases mentioned. Okay, so what about option A? So because of 2 reasons you can eliminate option A. The first reason is that combination is not mentioned anywhere in the paragraph. For example, I'll show you. See this particular point, second bullet point. 16 hours to complete both face-to-face education sessions, that is the particular option, 2 face-to-face. Once every 3 years, okay, 3 years. Then 2 case studies are there, but where is mentioning about 15 cardiotocograph in that point? Nothing mentioned about 15 in this particular bullet point. Okay, so that you can eliminate option A, now mentioning about 15 case studies related to that particular point. Okay, so because of that reason you can eliminate again contradictory or opposite option. Then another reason is that it is not 15 case studies. Actually case studies are 2. Okay, either you can say 15 simulator case studies or you can say 15 cardiotocograph training. Okay, so that because of that reason also you can eliminate option A. So answer is option C, whether you like it or not. My answer is option C. 2 case studies and 15 simulator cases every 3 years. Okay, and where is it mentioned? It is directly mentioned in this first bullet point. 16 hours to complete the online K2MS perinatal training programs once every 3 years. Then fetal monitoring training system as well as maternity crisis management training system. So those are what? The 2 case studies. Okay, so 2 case studies, those are the 2 case studies, 1 and 2. Then 15 simulator cases, that is 15 cardiotocograph, that is the question. Okay, how much? Then every 3 years, again already I've marked every 3 years. So from the first bullet point we got option C, 2 case studies and 15 simulator cases every 3 years. So option C is the correct answer. Clear? Any doubts? Okay, so B? Yes. Okay, so your answer is correct. So not mentioning 2 face-to-face, okay, once every 3 years, okay. Okay, so got it? Okay, Kavita. Okay, dear. Yes. So that's all about part B. So now we are moving to part A. That's the main. Okay, so vital session. Yeah. Okay, so we have a new topic here, which is stapler circumcision. Okay. How is the material? I think the material was very easy, but what about the question answers? Okay. Yeah. So what about part A? Okay. So let me know in the comment box how was his question answers. Okay. I mean the questions, especially the questions. Okay. I know that the material was very easy because very small paragraphs and very small text. So what about the questions? Okay. 1 to 7 set of questions. How was it? Was it very easy or average or difficult? I'm asking about 1 to 7 set of questions, okay? Okay, how is it? Kavita, Sobi, Libby, any idea? The questions, 1 to 7 set of questions, okay? Okay, so 1 to 7 set of questions that can be called match the following question. So here we are going to locate particular answers and we will write here in which text we got that answer from. Okay, so then only the mentioning of the text. Okay, if it is from text B, you can write B there. Okay, likewise you can write B. If it is from C, you can write C. Okay, so likewise only the mentioning of text. Okay. Okay, Grishma, it was difficult, right? Okay. Okay, Kavita, average. Okay, dear. Okay. All right. So coming back to the question. So the first question, okay? And before moving to the question, let me know, okay, was confused 1 to 7 little bit. Okay, little bit. Okay. So what about the strategy we are using here in part A? What strategy? Okay, so what method you guys used here? Any idea? The strategy or the method that will help you to find out the correct answers in part A. Okay. Yes. Any idea? What method? Okay. So the method is called elimination. Sorry, it's not elimination. It is skimming and scanning method or fast reading and searching. Okay. So with this, we are, okay, I think there are some technical glitches. Yeah. Okay, so coming back to the questions. Skimming and scanning, right? Okay, hi Jessica. Okay, Ellen Aji. Okay, Grishma. Skimming and scanning. Okay, Akku, skimming and scanning. Okay, Jaljan. Skimming and scanning method. So what is skimming and scanning? So everyone know about skimming and scanning. So let me ask you one question. What is skimming and scanning? What is skimming? What is scanning? So already I've told you. Skimming, which means fast reading, as well as scanning, which means we are searching for important words from the text. Okay. So what about the first question? Considerations that augment the prospects of infection subsequent to stapler circumcision. The only familiar word that you guys know from the first question, I think it is stapler circumcision, right? Yeah. So what about other words? Any idea? Okay, Akku and Jessica, fast reading and marking keywords. Yes, very good. Okay. Then, so what about the first question? Considerations that augment the prospects of infection subsequent to stapler circumcision. Okay, so my keywords, I'm not marking stapler circumcision here because, yeah, that's the topic. So my keywords are considerations as well as, yeah. Okay, so considerations and prospects, then subsequent. So these are my keywords from the first question. So any idea? What is the correct answer here? Considerations that augment which means increase. Okay, considerations here which means the factors. So the factors that increase the prospects which means number of, what is the meaning? Chances. Okay, the chances subsequent to stapler circumcision. So simply I can say this is the question. Factors that increase the chances of infection post to stapler circumcision. Any idea now? Very good. Okay, Sobi and Kavita. Okay, Anu. Okay, so answer is from text C. So my next question, where is it mentioned in text C? The number of chances or the factors that increase? Okay, Anita. Yes, Mida, it is from text C. Very good. So what about text C? Where is it mentioned? Okay, Jaljam, it's not from text A here, it's text C. Okay, yes, Aku, it is from text C. So where is it mentioned? In text C, factors augment, increase. Okay, so that's all about. Okay, text C. Yes. See, complications of stapler circumcisions. Okay, so what are the factors? Any idea? So factors that can increase the chances. See, so one is because of bleeding, then infection, proper healing, scarring, then adverse reactions to the stapler device, then pain. So a lot of factors mentioned, complications mentioned here in connection with stapler circumcision. So answer should be from text C. Okay, prospects of infection. Very good. Okay, so those are the keywords, right? Very good. Okay, Kavita, second side heading. Okay, dear. Okay, then the next question. Aggregate number of proceedings that got retrieved to have a circumstantial appraisal. So what do you mean by that? Circumstantial appraisal. So my keywords aggregate, proceedings, retrieved. Retrieved, which means recollected. Okay, collected, gathered, acquired. So aggregate number, which means, yeah, simple, total number of records, proceedings, which means the records mentioned there. Okay, and where is it mentioned? Total number of records collected, retrieved to have a circumstantial appraisal, which means a detailed evaluation. So circumstantial, which means detailed, elaborate. Okay, appraisal, which means an evaluation. Okay, any idea? Yeah, very good, very good. Okay, Libby, Kavita, Sobi, it's from text D. So your answer is correct, which is from text D. Okay, and where is it mentioned in text D? The total number of recordings or the proceedings. So which is from text D. Records identified through database searching. So that is mentioned here. As well as records after duplicates removed. Then records retrieved for detailed evaluation. So answer is actually here. Okay, so that's from text D. Okay, then the next one. Okay, Smita, Aku, Anu. Yes, text D, very good. Then the third question. Why is it requisite to retain the stapler for definite minutes of post firing? Okay, so requisite, which means it is important, it is necessary. Then to retain, to keep. Okay, stapler for definite minutes post firing. Any idea? Where is it mentioned? The necessary. Why is it necessary to retain the stapler? Okay. Hi Vaishnavi, good afternoon. Okay, Kavita, yes, Smita. Okay, so where is it mentioned? It is from text B. Okay, so that's from text B. Okay, so next, the surgeon fires the stapler. This causes the foreskin to be removed in one quick motion. Then simultaneously, see the next line, the stapler will be held in place for 3 minutes. Okay, so that is from text B. Okay, then the fourth question, what illustrations dictate one to have stapler circumcision? Okay, so what illustrations, any idea? Illustrations which I can say instances, okay, or the examples. Then dictate, that means to demand one to have a stapler circumcision. Any idea? What instances demand one to have this surgery or this stapler circumcision? Fourth one, what are the instances mentioned? Where is it mentioned? These instances, these illustrations mentioned? Okay. Yes, Libby, Kavita. Okay, any other answers? Okay, so very good, and that's from text A. Okay, so what about the instances mentioned there? Very good. Yes, so B, indications. A lot of common indications mentioned here, instances, okay, for doing stapler circumcision. So that's from text A. Very good, excellent. Okay, Smita, very good, dear. It's from text A. Then next one. Who is not dispensed anesthesia during stapler circumcision? So my keywords: who, dispensed anesthesia. Okay, so where they've mentioned about the term anesthesia here? In area, fifth one, who is not dispensed, which means who are not or who is not providing anesthesia during this stapler circumcision. Fifth one. In area, fifth question, who is not or who are not dispensing, providing anesthesia during the condition. Okay, so again, that's from text B. Okay, so what is mentioned here in text B? The surgical site or bleeding, as with any surgical procedure, there is a risk of post-operative bleeding. Then infection, the surgical site might become infected if not clean and dry, or if post-operative care instructions are not followed meticulously. Okay, as well as, see, then what is mentioned here? Okay, infants under 1 year of age. So where is it mentioned? Yeah. Okay. Yeah. So sorry for that. It's not from here. Surgical procedure. It's not surgical procedure. Yes. It is the person they're asking you. So yeah, it's from text B. Okay. So circumcision. Then in infants under 1 year of age, anesthesia is usually avoided. So my keywords, yeah, exactly. My keyword is anesthesia. Okay. And that's only mentioned in text B. So infants under 1 year of age. So who? Infants. Usually avoided. So answer is from, not from C, it's from B. Okay, Libby? Yes, it's from B. Then sixth one, the plausible convolutions of stapler circumcision. So plausible, which means possible. Okay, the probability they're asking you. Then convolutions, which means what? Complications, okay, or ramifications, okay, of the condition, stapler circumcision. Okay, Anita, fifth one is text B. Very good, dear. So what about sixth one? Any idea? Sixth question. Yes, the plausible or the possible convolutions or what? The complications of stapler circumcision. So that answer is from text C. Okay, so that is actually from text C. Yes, complications. Direct answer from text C, because a lot of complications mentioned here, or convolutions, ramifications. So very simple, it's from text C. Okay, yes, OB, option, it is from text C, complication. Okay, dear. Then what about seventh one? Seventh question. Conditions that are typically remedied with stapler circumcision. So conditions remedied as well as typically. Okay, so conditions that are normally or usually treated, remedied, which means, yeah, of course, treated with a stapler circumcision. Okay, any idea what are the conditions? So where they've mentioned about these conditions. Okay, so what are the conditions mentioned? A lot of common conditions mentioned here. Okay, with the help of this surgery, you can go with these different indications. Okay, or a lot of conditions mentioned here. So that's all about text A. So answer is text A. Okay, conditions that are typically remedied with stapler circumcision. So it's from text A. And here these are the answers. First one is C, second one D, third one B, fourth one A, then fifth one B, sixth one C, seventh one A. Okay, so now we are just moving to 8 to 14 set of questions that can be called short answer questions. Okay. Okay, so be very good. It's from text A. Yeah. Then eighth one, short answer question. First one, how long would the surgery of stapler circumcision last? Very simple question, right? Okay, they're asking you regarding the duration. How long, which means the duration. Okay, then so these are my keywords, how long as well as last. Okay, Kavita, okay Sobi, okay Libby. And you guys told me that it was very difficult, then you got 7 out of 7, right? Okay. Yeah. Anyway, what about 8th question? 8th one. How long would the surgery of stapler circumcision last? 8th one. How long? What is the duration mentioned? Okay, so the duration, yeah, of course it is mentioned in text B. Okay, and what is the duration? It is 15 to 20 minutes. Okay, that's from here. It takes 15 to 20 minutes for the surgery to get completed. Okay, very good. Exactly. Yes, OB, it is 15 to 20 minutes from text B. Yes, Libby, Peter, it's from 15 to 20 minutes. Okay. Then the next question. Okay, 9th one. Apart from non-absorbable staples, what else might be used to close the incisions? Okay, Libby, it's silicone ring, right? Very good. So that is silicone ring. So apart from non-absorbable staples, so my keywords are, okay, what else might be? So what, then close. Okay, so these are my keywords. And the answer is, okay, silicone ring. Very good, Sobi. It is silicone ring from text B. Again, it's from text B. Okay, see, next the surgeon fires the stapler, then this causes, so actually it is in the second line, simultaneously the incisions are closed with a silicone ring. So answer is silicone ring from text B. Okay, then the 10th question. The inappropriate following of which instruction could increase the chances of infection? Any idea? Yes, Vaishnavi, it is silicone ring. Okay, dear. Then what about 10th one? Inappropriate instruction increase. Any idea? 10th question. No idea? Okay, so what about 10th question? The inappropriate following of which instruction would increase the chances of infection? Okay, so answer is from text C. Okay, so that is a hyphenated word there. Infection, the surgical site might become infected if not kept clean and dry, or if post-operative care instruction. So answer is post-operative care from text C. Okay, so answer should be post-operative care. Okay, so when you write post-operative care, post-operative care should be there. Okay, so post-operative care. Okay, then what about the next one? 11th one. What condition can be defined as the inflammation of the glands of the penis, then presenting with redness, soreness and swelling? So a lot of symptoms mentioned here, and what is the name of the condition? So what condition? What condition can be defined as the inflammation? So any idea? Okay, so it's not balanitis, it is, okay, it is balanopostitis, right? Okay, and that's from text A, I guess. See, okay, so answer is from text A. And where is it mentioned? In which point? Is that the last point or the third last point? Okay, so that is an inflammatory condition of the glands. Yes, exactly. It is, yes, it's not balanopostitis, it is balanitis. Okay, an inflammatory condition of the glands of the penis presenting with redness, soreness and swelling. Very good. So that answer is balanitis. Okay, okay. Yes, Vaishnavi, Kavita, Anu, okay, Akku, yes, Libby. Very good. Okay, so now the next one, 12th one. The number of records acquired post the removal of identical ones. Number records. Then post. Okay, so what is a number? Okay, a lot of numbers mentioned here. Exactly, it is in text D. So what about the number? What number is mentioned here? Okay, So records post, which means after. Duplicates removed. Answer is 554. Okay, so 554. Then answer is 554 from text D. Then the 13th one, which device is used to detach, okay, remove the foreskin of the penis in stapler circumcision. So device, detach, foreskin. So what device is using there? Very easy question, right? Even without reading the para, you can say it is a stapler. Okay, so answer is that is stapler, and which is from text A. Stapler circumcision is a surgery to remove, which means detach, foreskin of the penis using a special device called a stapler. So answer is stapler. Okay, so answer should be stapler. Then 14th one. Okay, Prida. Hi, Prida. Yes, it is stapler. Okay, 13th one. Which device is used to, 14th one. Which are the two contingents in the database searching? Okay, so actually, this particular word, contingent, is a very common word in this exam. Okay, so contingent, which means group. Okay, a team, a group. So, which are the two groups? So, which are the two groups mentioned there? Two contingents, which means groups. Okay, in the database searching. So, database, it's of course it's from text D. And which are the groups mentioned here? Okay, two groups mentioned. It is OVID, OVID, as well as PubMed, PUBMED. Okay, so these are the two groups mentioned here. Okay, or the contingent. So that is OVID and PubMed. Okay, is it correct? What about you guys? 14th one. What is your answer there? Is it OVID and PubMed? Okay, Kavita, 13th one, stapler from text A. Okay, so what about 14th one, dear? What is your answer for that? Okay, so answer is OVID and PUBMED, PubMed. Okay, very good, Anu. Your answer is correct. Okay, any other answers? Okay, yeah. So now we are moving to the next set of questions, which is 15 to 20, and that can be called fill in the blanks. Okay. Yes, okay, so be OVID and PubMed. Okay. Okay, so 15th one. So fill in the blanks. On the condition that stapler has not been secured adequately, it may lead to shredding of the dash, partial removal of the foreskin, and the blades may end up injuring the glands. Any idea? Question is not a direct question, just an indirect question. On the condition that, okay, so stapler, so in the condition that, which means simply I can say, I'll read the question, if the, okay, so if the stapler has not been fixed, secured, which means not fixed properly, adequately, which means not fixed properly, it may lead to shredding. Shredding, which means what? What is shredding? Tearing. Okay, in the paragraph it is, I think, tearing of the dash, partial removal. Partial removal, which means an incomplete removal, right? Yeah, of the foreskin, and the blades may end up in injuring the glands. So any idea what is the correct answer there? Okay, Smita, you don't have to mention the numbers, okay? Just write OVID and PubMed, okay? Okay, dear? Yes. Yeah, what about 15th one? It is starting with if, okay? If the stapler has not been fixed securely, which means fixed adequately, properly, it may lead to shredding. Shredding, which means tearing, okay, of the partial, which means incomplete, okay, removal of the foreskin, and the blades may end up in injuring the glands. Any idea what is the correct answer here? Okay, already that answer is there. So what is the correct answer? Tearing of the dash. So what is tearing there? Okay, it's from text B. One of the procedure, okay, in the procedure they have mentioned about that. Okay, so, and where is it mentioned? If the stapler has not been fixed properly, it may lead to tearing of the foreskin. See, incomplete removal of the foreskin, and the blades may end up in injuring the glands. So this is my answer. My answer is foreskin from, oh, very good, Sobi. Okay. Yeah. So answer is foreskin from text B. Okay. Actually, foreskin is a single word. Okay, not foreskin. It is foreskin. Okay, 𝐿𝐵, your answer is correct, but it's a single word. Okay. Then the next question is yes, 16th one. Stapler circumcision is in dash, which imply you can go home the same day as the surgery. So imply, which means suggest. Okay. Or you can say suggestion as well as which yeah, of course, means. Okay. Yeah, one more, I'll write it. It is MENS, means. Okay, imply here means which means. So an idea, stapler circumcision is an dash, which means you can go home the same day as the surgery. Any ideas, Toby? Any ideas? Smita, Anu, Kavita, Preeta, Vaishnavi, Akku, Libby, Anita. What about 16th question? Okay. Very good, Anu. Yes, Vaishnavi, outpatient procedure. And where is it mentioned? It is mentioned in text A. See, an outpatient procedure. So what was the previous line? Okay, it is an outpatient procedure, which means you can go home the same day as the surgery. So it is outpatient procedure from text A. Very good, very good. Okay, Preeta, Anu, yes, it is outpatient procedure. Then the next one, 17th one. The dash might cause infected if not kept clean and dry, or if post-operative care directions are not adhered meticulously. So any idea? So adhered, which means followed. Okay, it's not following meticulously. Any idea? 17th one. Okay, Kavita, 17th one answer is yes, surgical site. Okay, dear. I think the site it is SIGHT or SITE. Yeah, okay. Okay, Binu, yes. Anu Thomas, Sobi. Okay, Preeta, Jeljam, Libby, Peter, surgical site is the answer. Very good, very good. And where is it mentioned? It is in complications from text C. Okay, so here in infections they have mentioned about the surgical site might become infected if not kept clean or dry, if post-operative care instructions are not followed meticulously. Exactly. Okay, so answer is surgical site from text C. Very good. A lot of correct answer. Okay, Nisha. Hi, Nisha. Okay. So yes, coming back to the question. Then 18th one. To corroborate the absolute removal of the foreskin and also the contraction of the dash, the stapler should be held in place for 3 minutes after firing. Already we have seen that particular word, right? When you deal with 1 to 7 set of questions, yeah, 3 minutes was there. Okay, so where is it mentioned? Of course, that's from text B, and we have seen that 3 minutes there. Okay, in text B. Okay, so what about the answer? The stapler will be held in place for 3 minutes. Then after firing, this ensures complete removal of the foreskin as well as compression of the blood vessels. So answer is blood vessels. Okay, and that's from text B. So answer should be blood vessels from text B. Okay, Nisha? Okay, yes, it is blood vessels from text B. So the second last question, 19th one. Yeah, the number of studies excluded from screening of titles and abstracts were dash. So what is the number of studies mentioned? Again, number of studies, which is here. Okay, and studies excluded from screening of titles and abstracts, that is 539. Okay, very direct answer, which is 539. And I am jumping to the final question. Dash is a condition where the foreskin that has been retracted cannot be moved back to its original position. Any idea? Oh my god, a lot of correct answers. Okay, Preeta. Yes, Sobi 539. Okay, Libby 539. And what about the last question, guys? Dash is a condition. So what is a condition? Okay, and that's from text A. paraphimosis is a condition where the foreskin that has been retracted cannot be moved back to its original position. So paraphimosis should be the answer. Okay. So anyone with 20 out of 20? Okay. Okay, Binu, yes. Preeta, Libby, Anu, Sobi, Kavita, Vaishnavi, paraphimosis. Exactly. Okay, so may I know anyone with 20 out of 20 for this material? Okay, I'll wait for your marks here. Okay, Kavita 20. Okay, so what about others? Anyone with 20 out of 20? Okay. Okay, Smita, it is paraphimosis, okay dear. So what about your marks? Okay, Akku, 20 out of 20. Okay. Okay. So that's all about today. So yes. Okay, most welcome. So thank you so much. So see you tomorrow. Take care. Good day.